Well, the cost of your health insurance plan at work is set to soar next year. This according to a new study. Large employers say the cost of health care plans will grow 5% next year to an average cost of more than $14,000 per employee. And that makes the 5th year in a row that costs have risen 5%. You add that all up, that is real money, friends. Your share of those higher costs will likely be $4,400 in premiums, out-of-pocket costs, and contributions to health savings accounts. But the majority of the tab gets picked up by your boss, who shoulders 70% of those costs. Here to discuss, Paul Howard, a senior fellow at the Manhattan Institute, and Phil Kerpen, the American Commitment president. Phil, I'll start with you. How much of this can Americans take? Look, at the end of the day, I believe that the system by which employers provide health care has been a boon, a great thing for workers, for Americans, but this really seems to be testing Americans' wallets.
Well, I think we're coming back first full circle to the original fundamental problem in the healthcare system in America, which is that it's too expensive. And, you know, we got really served a bait and switch by the Democrats, who said that they understood the problem was cost, and then they passed legislation that was entirely coverage expansion with no cost containment of any kind. Yeah. And the cost drivers, if anything, have gotten worse as a consequence of that. And so we're really where we've been for a long time.
Prices going up. And let me tell you, so here's what I thought was really interesting today. The National Association of Insurance Commissioners, obscure group, really regulates insurance state to state. They were meeting, and among the suggestions for making the Obamacare exchanges work, because it's on their shoulders to do that, was the idea that maybe what you do is you tell these insurers to raise costs across the board on all of their products. And Paul, to you, that means 5% next year. Well, that may look like a song. Maybe it goes to 10. What do you say?
Look, since we're talking about the Obamacare exchanges here, I mean, double-digit rates in a bunch of states, 45% in places like West Virginia.
But what I'm saying, wait a minute, before you go to that, it's going to impact even more what's going on for everybody else.
Absolutely. So it's not just people who are on the exchanges. Anybody who's in the individual market who's paying that is going to see their premiums go up. And so those people are feeling the real pain, not the people who are near poor, who are virtually 100% or 100% subsidized by the federal government, people who are paying 100% out of pocket.
When I go out and talk to people about their health care coverage, it's the folks who own their own business and have to provide health care for themselves that are getting hammered here in that individual market that you talk about. They are paying the most right out of pocket. And we find out just today, Anthem is pulling out of Obamacare exchanges in more states, many counties in Nevada. Phil, to you, where is this all going? Are these exchanges going to be able to stay in business in 2018?
They're very near collapse in many places. We're looking at least 40% of the counties in America that will have 0 or 1 insurance company left. That Anthem pullout in Nevada was a big deal because they've now got a number of counties in that state that are going to have 0 insurance companies next year, along with places in Tennessee, Ohio, several other states. The problem with the way that Obamacare was designed is they basically told all these states, dump everyone who was in your high-risk pool, your subsidized uninsurable pool, put them into the individual market. Everyone else who had a pre-existing condition, come on down, get in the individual market. And so we have a lot of very sick people with very high cost conditions,
and we have no young people to offset that. I mean,
they have no reason to buy it. Why would you buy if you're young and healthy at those prices?
Paul Howard, to you. You know, one of the things that these insurance commissioners are talking about, and what they're really worried about, frankly, is that some of these consumers will be signing up for zombie plans at the end of the day in 2018. Will you really get coverage? I mean, look, the bottom line is having coverage is no guarantee of treatment.
Right. What they're saying is that with the largest insurers pulling out of the market, and they have the Anthem, the Cignas, the Aetnas pulling out of the market, small insurers, not with the big networks. So all these people are going to be crammed into smaller plans with limited networks. Could see people waiting for access.
It's already happened. It's just getting worse and worse. That's the thing that's so distressing to me about it. I mean, people who really just want to get coverage, the options seem to be narrowing instead of getting better over time with Obamacare. I'm going to have to leave it there, guys. Paul and Phil, thanks so much for coming on tonight. Really appreciate your time.